We all know that suicide affects family members and friends and acquaintances. But we're finding that physician-assisted suicide causes less suffering for family members and friends than other forms of suicide. Suicide can wreak emotional devastation on families, cause guilt, anger, depression, etc. A new study was performed in Portland, Oregon, where physician-assisted suicide is legal. And the physicians interviewed family members of a patient who chose physician-assisted suicide, and they interviewed them for 1 year. Their findings found that 11 out of 100 people still had symptoms of depression, and that 2 out of 100 had some symptoms of grief. These findings were then compared with family members who had lost a loved one from natural causes or terminal illness, and the findings were the same. So their suffering was very similar to that of a person dying of natural causes. It basically allowed them to cope and grieve in a very similar way to just losing a loved one, not by suicide. It caused less anger, less guilt, less depression, etc. Another study that was found showed that the family members of patients who chose assisted suicide were better able to accept and respect the decision of the patient to have physician-assisted suicide than choosing another route of suicide. One of the biggest issues of suicide is that a lot of these people are committing suicide in the home or near the home, and family members are the ones who are finding their deceased loved one. Finding a loved one dead from suicide makes a victim out of the survivors. It causes emotional trauma and distress in their life. They can develop PTSD, and many of them experience symptoms such as isolation, nightmares, terrifying memories, panic attacks, rage, anxiety, debilitating worry, frustration, etc. And frequently the family is faced with helping with some of the cleanup of the physical remains. They could be cleaning up blood, bone fragments, and other things. And this type of situation really complicates the grief that this person is already experiencing from the loss of the loved one. They can have flashbacks of the scene, and it can really wreak havoc on their life. So with physician-assisted suicide, we can eliminate this problem of having family members find their loved one deceased and having to deal with the trauma of cleaning it up. With physician-assisted suicide, the family members will be able to grieve and cope in a way similar to having a family member die from natural causes, and they won't be traumatized from having to do the cleanup and find the body. They'll also be able to accept and respect the decision of that person, and better than if they had chosen another route of suicide.